Hi, I'm Dr. Jerry Suddeth from Crestwood Animal Hospital. I'm here today demoing Vetland's anesthesia monitor with them. We're going to go over how to use it on a patient who is anesthetized to get proper readings and use of the monitor. Paige is going to be helping me out here today, and she's going to go ahead and turn the monitor on for us. We have already hooked up the patient. This patient has been stabilized with anesthesia at this point in time, but we're going to walk you through what we would have done with hooking them up originally here. Okay, the first thing that we want to do with our patient is go ahead and get them their leads hooked up appropriately. Paige here is going to show us with the leads here. We do everything in lead 2, which is what the monitor is defaulted to do. You need to place them appropriately. They are labeled. The red lead is going to go right back here on the left side, right here on the flank here. So you want to put that on Paige. The left black lead is going to go in the left axillary region here, and then the white lead here is going to go on the right side in the axillary region as well. You want to make sure that you get good contact with the skin. A good thing about these clamps is they're not so strong that they're going to damage the skin. Some other ones I've used do leave little marks. These absolutely do not. You want to get good alcohol on those leads in order to get an appropriate reading. Since our patient today has already been in a plan of anesthesia, her heart rate is appropriate. She's right around 115 beats per minute on the monitor. You can always double check that with a stethoscope to verify that. You should always double check, even though this monitor does a great job, you want to make sure that you're double checking that as you go. I do use pre-anesthetics to keep the heart rate up. I use atropine with our patients, so if you're not using atropine as a pre-med, you might have a lower reading than 115, and that would still be normal. The next thing after getting your ECG leads on, I like to put the SpO2 monitor on. We put that on the tongue. You can use that on other mucous membranes, but the tongue you're going to get the best reading on. Sometimes it might dry out a little bit. You just want to moisten the tongue and put that back on. You will find that you see a little red light right here on the SpO2 probe itself. You want that to be on the ventral surface of the tongue or the bottom of the tongue in order to get the best reading. So you just put that on right here, and then it'll re-register here and get our reading for us. An ideal reading that you want for that is going to be as close to 100% as possible. No patient's going to stay at 100% the whole time. As long as you're above 90%, most anesthesiologists will say that that is acceptable. So, we're cruising right at 98, 99 right now, so our patient's in very good shape. After getting the SpO2 monitor on, the next thing that we want to do is get our blood pressure cuffs on. I find that with other veterinarians, that's one of the most common mistakes as far as selecting the blood pressure cuff appropriately. The way to best to select that is to take your cuff and you want to compare it to the width of the limb that you're putting it on. I find that the best places to get your blood pressure is going to either be using the hock or the forelimb. You can use other areas like the tail, but like our patient size, tail size is very variable, and you're not going to get as sensitive of a reading there. So I don't recommend using that as your primary source. Try either the forelimb or the hock first, then use the tail as a third option. You also want to make sure that you're not using the limb that you have your IV catheter placed in, because again, that's going to affect your reading and affect the flow of your fluids during your procedure. When selecting it, you want the cuff, the width of it here, to be about 40% of the width of the limb here. So right now, let's see here, we have a size 2 on this hock, because that's about appropriate, so that's what's around here. Up front on the forelimb, you think of our patients, their back legs and their front legs aren't always going to be the same diameter. So you may have to use a different size cuff. Up front, we have a size 3 on the forelimb up here. Again, about 40% of this on the limb that does not have the IV catheter placed. As far as hooking that up, it's a quick release system here. On the adapter here for the blood pressure cuff, it just pulls on and off. Very easy to use. You just clap that back on and you're all set. I have our system set up to read every 5 minutes, but you can manually do it by hitting the blood pressure button on the unit that Paige is hitting right now. So we're going to demonstrate that. Isoflurane at initial anesthesia will lower their blood pressure, so you have to take that into account. But generally speaking, the most important value for our patients is the mean systolic pressure. You want that to be at least 60 millimeters of mercury. So that's the number on the monitor here. It's quasi-reading right now, but it's the number in parentheses. So we'll look at that number. Your systolic and diastolic is going to be comparable to what you see in people. You want that to be, about 120 over 80 with variability depending on the size and maturity of your patient. Takes about, maybe a minute or so to run, and again, you will get that value at whatever interval you set, whether that's every 3 minutes or every 5 minutes. Let's see here. After that, The other leads that we can use are our temperature probe. We use this rectally here. It is already inserted here, but it will stay with your patient throughout the entire procedure in order to keep their temperature monitored. We use heating pads underneath our patients to keep their temperature elevated at least at 98 degrees, with normal being 1015 to 1025. As you can tell with our reading, since we just hooked up our patient to anesthesia, our blood pressure is reading a little bit low, but again, once we start a procedure, that will elevate and maintain appropriately with our IV fluid support. So at 54, I'm not worried about that right now. That will quickly come back up to 60 momentarily. Another reading that's on our unit that you don't have to hook anything else up for is our respiratory rate. If you look at the monitor, it is the yellow number at the bottom. It's one thing that's cool about the monitor itself is you can change the settings and get the numbers larger. I like this particular setting, and my technicians like it because everything is color-coded and larger. But the respiratory number there at the bottom, 30 breaths per minute, is a normal range. Most patients will be about 12 up to about 30 or 40 under normal circumstances. If it's elevated beyond that, then you need to reevaluate your patient and correct any pain management or anesthetic depth level. That is measured indirectly off of your ECG leads, so nothing else you have to hook up. I think that's about it for the monitor. If you have any questions, be sure to check out Vetland's website. They can help you out with anything else. Thank you for stopping by.